My name is Shaheel Chummun. I'm a consultant plastic surgeon and cleft surgeon at the University Hospital of North Bristol. I wanted to become a doctor because primarily I wanted to help patients. And during my medical training, I decided I wanted to become a plastic surgeon because it allowed me to, because plastic surgery covers such a wide spectrum in terms of the management of patient. We involved with the treatment following burns, we do involve with patients who needs reconstruction following trauma, following cancer resection, and all of that I felt was very, very interesting in terms of a subject to go into. I chose to do cleft lip and palate surgery as my main subspecialty because it allowed me to treat patients from babies up to the way to their adulthood. So essentially, I see patients who come in to see me because they have a cleft lip and palate. So I would normally operate on them when they are between the ages of 3 to 18 months. Subsequently, they may require other surgeries for their speech. They may require surgery to their jaws or surgery to their nose or face when they're an adult. And I think given that spectrum where the variety of surgery that I can perform, it makes it very appealing. And also it allows me to build a nice rapport, not only with the patient over the many years, but also with their parents and their family. What I find most rewarding with my job is the relationship I build with my patients and their families. Very often, I operate on babies who are between the ages of 3 to 12 months, and then subsequently, I need to operate on them when they are later on in their childhood, or I operate on them for their, for example, rhinoplasty when they're an adult. And this allows me not only to build a lovely rapport with my patients over throughout their life, but also it allows me to build a nice rapport with the parents as well. And I find building this kind of humane rapport with the families and the patient is very rewarding. I think what I find most valuable about my patient is the it's the fact that they are always very willing to is the trust that they give me to operate on their babies. And often I find that is I personally would find it very hard if I was to give my child to somebody else to operate on them. But I find that the trust they put into me and the team that I work with, that they allow us to help their children, which I find extremely rewarding. And I think what my patients like with me is that I tend to be quite open and frank and to the point about things. I do like to listen to what their concerns are, and I try my best to alleviate any concerns they may have. But at the same time, I like to explain things in a simple way so that they are able to make the best decisions that they require for their treatment.